Now for next up, we'll get to look at bimanual digital examination. Bimanual digital examination. Alright, so it's a component of gynecological physical examination. And when they say something is bi, they mean that thing is two. Okay, so bi is like, two hands. Okay, manual, you are manually doing this thing. So digital is another name for hand. So you are using your two hands to physically feel out for something. Okay, so it's actually a cornerstone of gynecological physical examination. It allows clinicians to access the size, the shape, the position, and the mobility of uterus and adnexal structures. And it will help you to be able to dictate if there's any tenderness, if there's masses. Do you understand? So step by step guide to bimanual physical examinations. These images should serve, right? Are beautiful images. It's a bimanual digital examination. So preparation and consent. Okay, so you explain the procedure to the patient. Okay, I'm actually going to feel you. One hand will be inside you, one hand will be on the abdomen. Do you understand? And this is what I'm actually trying to look out for, so that the patient knows what is happening and the patient knows that it's for their good. Ensure privacy, as use a hospital screen, and a chaperone should be there. Okay, ask the patient to empty their bladder for comfort and accuracy. So position, so that the patient lies in the dorsal lithotomy position, that's on their back, knees bent. Okay, so lithotomy, everybody here knows what is lithotomy, right? So it's just like you're lying head down, but your legs are, kind of like your legs are flexed. Okay, then external and speculum examination. Sometimes you can use the speculum, where you now check out for lesions, there's discharge, signs of trauma. Okay, so performing the bimanual examination, you have to lubricate the hand you are putting inside the vagina. Okay, then gently inside the hands into the vagina, locate the cervix, place the other hand on the abdomen just above the pubic bone. Use both hands to palpate the uterus between the fingers. Okay, move hands laterally to access, if there's any mass or tenderness. Okay, so clinical interpretation. Normally the uterus should be firm. Do you understand? Mobile and non-tender. If there's masses, you could actually pain the patient. If there's cysts, the patient is complaining about so much pain. Then in pregnancy, of course, the uterus will not be firm. Okay, to not be firm, it should kind of like be so soft because of what the hormonal interplays you have. So special considerations in cases of pelvic pains, bleeding on unsuspected pregnancy, you should be very, very cautious. You should be careful. You should be very much more gentle. Okay, so that's what the bimanual digital examination simply means in gynecology.